I think the link between nutrition and infectious diseases has been elaborated this morning by your colleague of Gain very well. Just a glance back on nutrition 20, 30 years ago. Food security, or when organizations talked about food security was interpreted as having enough to eat, having enough calories to eat. The notion of food quality in international organizations came in rather late. I would say not more than really 10, 15, 20 years. The nutritional quality term is being accepted in international organizations as being part of food security. And we will see in an example we saw this morning that food quality is a crucial part. When I talk about a framework for public health nutrition, I want to make it very easy because I'm working in a research institution of a global corporation. And if I talk to the people, I would like to get money for my research, as you do. Do you want money for your research? So you go to funding agencies. I need to do it in very simple words. So please allow me not to talk too scientifically, but in very simple terms. And that's a framework. If you want to intervene, and again, I come back again that nutrition is not high up on the agenda, and the research quality nutrition is most probably not comparable to research quality in a lot of medical disciplines. It's very simple. First of all, we need to know what do people eat and what are their nutritional needs. So we have decided to run a rather large-scale dietary intake surveys looking at the diet composition, the diet quality, and we're operating at the moment in 10 different countries doing that with a very large project in the US where we are the only ones who are actually looking what infants are eating from 1 to 4 years of age. It's the only research that is available, primary data collection in the US and that. So that's one of the examples. The second question is when, from a global corporation point of view, when you are a company is, do and can we address health issues? If you know there's nutritional needs, there are nutritional gaps, the question is then, can you address that with your current so-called product portfolio, or can you address that as a company to develop systems or products? The next question is then, how do we make the foods? Because once you have identified a potential, we call it route to market. We talked about accessibility, availability. If you have a product on the market, is then, can we make the food better so that it responds to the nutritional need that we have identified? And the last question is then, what's the impact? Increasingly, there will be demands on all type of programs, and I talk out of experience because I was a government official before, where I always asked companies, research organizations, what's the impact? It's not enough if we talk an output and we say the numbers of what we do, but what is actually the impact of what you do? So I will walk you now through an example where we specified and we go through these type of questions, where we looked at it from a very systematic point of view, and all this data are, of course, published data. No surprise, the prevalence of iron deficiency anemia in India is extremely high. And we just spoke about the link between infectious diseases and iron deficiency, and where it's not very clear who is at the beginning and how does it influence each other. But what we see, from 6 months to 2 years of age, nearly 50% of the Indian children are iron deficient. You talk here about 120 million children in each birth cohort. So it's a huge number, and this is mainly due to the vegetarian diet. So coming back to the framework, okay, we know that there's an issue. Now let's look at the product. Do we have a product that can actually tackle that health condition and can help improving it? And on the right-hand side, you see anemia risk reduction with fortified cereals. So fortified infant cereals is an infant cereal that is an appropriate complementary feeding after 6 months of age for children, and that is multi-micronutrient fortified, and we have a product like this on the market in India. And several reviews have concluded that through fortification of infant cereals or fortified milks, you can approximately reduce a relative risk ratio by 50% through iron fortification. And international organizations, and that's then also very important, if you do it as a global corporation, you have to see, does the framework provide me guidance so that I can actually go in that direction, even if the evidence is there, because the political framework is very important. And as we saw this morning, the Global Alliance for Improved Nutrition issued a guideline on improved complementary feeding, and they explicitly say fortified processed foods can make an important contribution to improving nutrient intake by pregnant and lactating mothers and children aged 6 to 23 months. So we know that the product works, and we know that we are playing in the right field, and we have support from international organizations to do so. Now let's go further, and let's say, how does a global corporation then integrate it into its commitments? And we heard this morning from the colleagues from pharmaceutical industry that we also have commitments, and I believe, or we believe, that we can only live up to commitments if it is an integrated philosophy into the everyday business doing. And we call that creating shared value. And one of those is to help reduce the risk of undernutrition through micronutrient fortification. We have set an output, not an impact target, because that was a couple of years ago. By the end of 2016, we want to reach 200 billion of servings of fortified foods being distributed or being sold globally. Creating shared value means that you create value for the society, but at the same time, you need to create value for the company, because otherwise it's not sustainable. Because let's face it, and let's be very honest, global corporations are making money, and they have shareholders who look upon us and want also to have a certain return on investment. Otherwise, they put their money elsewhere. On the other hand, you as a global corporation, you have a large responsibility for the societies you operate in. And here, it is very interesting to bring these two together. And this is a concept of creating shared value described by Mark Porter in the Harvard Business Review, a fantastic concept where Nestlé has put all his business doings towards his contacts in different areas, water, sanitation, rural development, etc. So, having the framework from an international organization, having the framework within the company, it is now interesting, how does this product work? So when we look at fortified baby food consumption, and here we come back to the reality situation is, if GAIN is saying fortified complementary, processed fortified complementary feeding being produced by industry can have an effect, well, the picture looks not very good, because only 18% of the people can actually access or do access this fortified baby food. The other 82%, about 100 million children, are using traditional meals that are nutritionally empty. You can see that in India, and we looked at it. We looked actually at the 4,800 households where we looked at the motivation, we looked at what people eat, and you see that the feeding for babies after 6 months of age, so you have ideally the breastfeeding, and then the complementary feeding does not look good nutritionally. In India, there is a National Family and Health Survey, and which is part of the DHS survey, a huge survey being conducted by the American government, by US aid in fact, in a lot of developing countries. It's a fantastic survey, accessible online, and they ask a couple of questions on nutrition, health data, etc. A couple of questions. They actually asked quite a few questions. It's most probably the only survey which is repeatedly done globally. And we have a question asking, any commercial did you eat yesterday? So that's a classical dietary intake survey. Any commercially fortified baby food such as Cerelac or Pharax? Why do we mention the two names Cerelac and Pharax? For those of you who have worked in development countries, people will most probably not be able to talk about fortified baby food. What is fortified baby food? They will not be able to answer. But they know the brands. So Cerelac is the Nestlé brand, and Pharax is a competitor brand. I cannot divulge you the market share we have, but the market share is very considerable in this country. Why do I say that? I'm saying that because if you look now at an intervention, and as we saw before, the mothers who are buying the food, and they are paying themselves out of a pocket for that, have an extreme high adherence rate. They buy the food and give it to the children because they pay for it. And we can prove that they actually consume it. Second, we do not need to change any behavior. The people are actually buying it already, and through the survey of 5,000 households where market research is meeting proper research, I would say, what you could see is that the main motivation block is price. These 82% would love to buy it, but they cannot afford it. So the question is, how can we make the product affordable in order to reach and in order to get to the 82% who do not have fortified baby food? So here, I think it's quite an ideal combination possible between public and private in kind of coalition, or in a different way to look at it. How can we actually get into the 82%? Now let's come to the impact and to close the circle. Through this DHS survey, we could, and I talk about the right-hand side, the impact of a feeding type, you can differentiate between the population that has access to fortified baby food and those who does not have access to fortified baby food. And of course, the main confounding factors such as education of the mother, such as infection, are of course being taken into consideration when you look at on the right-hand side at the graph. And as you all know, the threshold between moderate and mild anemia is around 100 grams with irreversible cognitive effects. And what you can see, that those who consume baby food, commercially fortified baby food, are considerably better off than those who do not consume. So the impact of the current business model, looking at real-life data being gathered by an international organization, are there. This we just published, I think, a week ago in PLOS ONE. So we're actually driving, creating, or shared value on the societal side. On the business side, apparently it's a sustainable model, otherwise you most probably wouldn't engage in selling fortified baby foods in India. Now also on the health economics, and here that is something where we use health economic tools and applying them in nutrition, which is also rather new. I myself, I'm a medical doctor, but I'm also a health economist, so it's a combination of both, of the worst of both. A doctor that makes money. But what you can see is production losses and intangible costs in India are enormous due to iron deficiency and the cognitive defects. And if we could only lower the price by 20% for the poorest 40% of households, we would have a intervention cost per dali saved where you would think in Western societies that's definitely a way to go. It is highly cost effective. So with that, I think I would like to close and would like to show you just how you systematically go as a food company, talking and selling your food products to the consumer. We do not have organizations that absorb our costs as health systems or others, and still can drive impact, but we would very much like to move further. And I would like to close with, maybe we can fly together to New Horizons. And does anybody know what that is on the photo? So this is one of the biggest aircrafts in the world, and it's entirely solar energy powered, and it's just now based in San Francisco, and it's going to take on the flight from San Francisco, most probably ideally to New York. And I'm very happy that one of my team members is actually making the food for the pilots, who sometimes are 4 to 5 days in the air, and it does not use any energy, flies day and night. It's an absolute fantastic. So on a private, go on the website, have a look at it. It's just hilarious if you talk about sustainability. And I think for me it's a wonderful image of flying to new horizons and building partnerships and new coalitions. Thank you.